We are going to start today's webinar. I welcome our panelists and participants. First, I want to say that please put your mic on mute so that we can have a smooth discussions. I welcome all our panelists and all our participants. I want to introduce today's webinar's moderator, Mr. George Cherian, who is a director in CUTS and working in the civil society sector for last 25 years, more than 25 years. And he's leading the FoPL work in the CUTS. He's our team leader. So over to George.
Thanks, Madhusudan. Good morning, everyone. And depending upon which country you are, good evening as well. We have about 116 participants registered for this program from about 15 various states in India, mainly representing the consumer organizations, representatives of the civil society organizations, officials from the Office of the Food Safety Commissioners in various states. We also have doctors registered from 4 AIMS, All India Institute of Medical Sciences. We have health experts and representatives from the business community as well. We have a couple of colleagues joining from outside the state, from Bangladesh. We have a representative from OECD joining from Paris. So we are happy that the interest shown by all of you in joining this webinar. We have 4 speakers who will be sharing their thoughts and making presentations in this webinar. Dr. Alexandra Jones from Australia, Dr. Pankaj Bharadwaj from AIMS, Jodhpur, Advocate Saroja Sundaram from CAG Chennai, Mr. Amit Khurana from Center for Science and Environment, New Delhi. I will be introducing the panelists in detail later. Before that, I would like to give the context and the background of this webinar, because some of the participants are new, who are not aware about the FoPL process in the country. Some are already involved in the process, so they are familiar. For the sake of the new consumer representatives and all, I would like to give little bit background of the FoPL process in India and the purpose of this particular webinar. I request all the panelists to keep your video on. The other participants can mute their mic and switch off the video. As all of you know, right to choose and right to information are fundamental consumer rights. Front of pack nutrition labeling is a cost-effective messaging strategy to help consumers to make informed and healthier food choices by helping the consumers to correctly, quickly, and easily identify products that contain unhealthy ingredients such as sugar, salt, and fat. And there is an urgent need for this FoPL than ever before. The reason is, as we all know, world is still in the grip of the pandemic. This had made consumers increasingly conscious about health and lifestyles and the quality and the safety of the food that they are consuming. A recent report by Google India, which is titled, "What is India Searching For?" shows a huge jump of 500% for searches related to health and healthy products, especially for those that supposedly boost immunity. This is during the lockdown, the huge jump in the search. Consumers everywhere believe that better way to fight the virus is to have healthy food and in turn enhance the immunity of the body. Non-communicable diseases contribute to about 62% of total preventable premature deaths in India, which includes CVDs, cancer, and diabetes. Studies during the pandemic shows that people with pre-existing NCDs and comorbidities are more vulnerable to the pandemic. One of the main reasons for increasing number of NCDs in our country as well as elsewhere are the consumption of unhealthy food with high fat, sugar, and salt. So we believe FoPL promoting healthy diets coupled with the reduction in the consumption of ultra-processed food, high in fat, sugar, and salt, will play a critical role in combating the NCDs. I'm not going into the details of the health aspect. Dr. Pankaj will be talking about that dimension. And another thing is, however, it is difficult to make the correct choices. The reason is availability of large number of products make shopping for food a confusing process for consumers. Having so many different types of food from both domestic and foreign manufacturers make it difficult for consumers to select nutritious products, even if an increasing number of them want to make healthy choices. Most consumers, several studies in India, most consumers spend fewer than 10 seconds selecting each item, which does not give them enough time to compare the nutrition facts panels that are found on the back of packaged food. So we believe if a FoPL presented in an easily understandable manner on the food packs could aid the consumers make healthy food choices. A little background, the history of the FoPL process in India. The food regulator, FSSAI, constituted a committee way back in 2013, and the committee submitted the report in 2014 recommending for introducing the FoPL. So that means the process in country is almost 8 years old. After years of consultation in 2018, the food regulator published a draft Food Safety and Standards Labeling and Display Regulation 2018. In 2019, FSSAI issued draft notification Food Safety and Standards Labeling and Display Regulations 2019. In 2019, December itself, FSSAI dealing the FoPL from general labeling regulations. So the present phase of consultations which is going on to fast track the whole process of FoPL, because everybody is feeling that it is too late for India to introduce the FoPL. It started in January, and many of us consumer organization representatives and other civil society organization representatives are part of this stakeholder process, which almost concluded the discussions, and we have reached a consensus on many issues like ingredients to be included in the FoPL format, or whether it is per serve versus 100 gram ml. Most of the issues we have reached a consensus. But one of the major concerns which yet to be decided is the format for the FoPL in India. Some quarters believe at the conclusion of this thing, it is the summary ratings which will be suitable for India. However, we consumer organizations and other civil society, we strongly believe that it has to be a mandatory warning label is suitable for a country like India. This is the context in which this webinar is organized. Still, we are debating, and some national survey is going on to decide about the format. So I would like to come now to the topic of this webinar, which is why health star rating label is not suitable for India. Health star rating, as many of us know, overall nutrition profile of packaged food, and assigns it rating from half a star to 5 stars. The more the stars, the healthier the choice. However, a big flaw which we believe in the HSR system is that unhealthy products are still able to get a high score. This is because the rating is based on the overall nutrition value, and the inclusion of healthy ingredients like fiber, protein, and vitamins cancel out the unhealthy ingredients like sugar, saturated fat, and salt. HSR is mainly implemented, as all of us know, in Australia and New Zealand. And in Australia, it was introduced in 2014, which completed 5 years in 2019. We are happy that we have an expert from Australia who will be speaking about this later. But we also had gone through some of the studies. On completion of 5 years, the government had evaluated this HSR system, as well as many of the universities and health institute in Australia also had done various studies. A group of experts from Deakin University published an article which is titled, "How does the Australian Health Star Rating System perform after 5 years?" And this study or the article says, the design and the implementation of the current HSR system is misleading consumers about the healthiness of many foods. It further says, results indicate that currently implemented HSR system is inadvertently providing a health halo for almost 3/4 of ultra-processed food and half of discretionary foods displaying HSR. 73% of ultra-processed food and 52.8% of discretionary food displaying HSR have 2.5 stars. They were able to get. This is one study says. Another expert, who is the public expert, Grant Schofield, who is also the Chief Health and Nutrition Advisor, Ministry of Education of New Zealand, says the health star rating is already dead in the water. The algorithm is flawed in the combination of fat, salt, and sugar. The food industry brought this to us. We were suckered in. Perversely, very high sugar foods can get 4+ health stars. And India needs a nationwide. One of the arguments also, being said this, I also would like to mention that there are experts and the government evaluations in Australia, which also think that this HSR had worked well. So there are various viewpoints on introducing the HSR system and the 5-year evaluation of the HSR system in Australia and the New Zealand. Another argument put forward by many people are the Indian consumers are familiar with the star rating because the electrical equipments, we have the star ratings. But one of the recent studies shows 1/4 of the Indian households are not still familiar with this star rating. I'm not going into the details of that. So that is not an easy thing to introduce. And being said this, we strongly believe that it is the mandatory, warning labels which is suitable for India. These indicative labels are adopted in countries like Chile, Canada, and Israel, Peru. In a country like India, still, only 77.7% of the people are literate. We believe it should be very communicative. Warning label should be thing. Warning label should act as a useful tool to aid consumers while choosing between healthy and less healthy products. So this is the context, why we have chosen the topic of this particular webinar and what we strongly believe that India need, and we would like to hear further from different experts. Now I conclude my introductory remarks and would like to introduce the speakers. As I mentioned, we have Dr. Alexandra Jones, who is a research fellow in food policy and law at the George Institute for Global Health, situated at Newtown in Australia, joining with us from Australia. Her current research interests include food labeling, fiscal policies to improve diets, and the transition to healthy and sustainable food system. Very interestingly, she holds her PhD in public health from the University of Sydney that specifically explored the effectiveness of the health star rating and similar front of pack nutrition labels worldwide. So she had studied about various health labeling. we are extremely happy that Dr. Alexandra is joining with us, and she will be talking specifically on what India can learn from the 5 years of voluntary health star rating in Australia. Welcome, Dr. Alexandra, to this webinar. And I also welcome and introduce Dr. Pankaj Bharadwaj, who is the MBBS MD doctor, additional professor, community health medicine and family medicine coordinator, School of Public Health at AIIMS, Jodhpur. And he's also the vice dean of research at AIIMS. He's a member of various national and international health bodies, and he's also a member of various ICMR and WHO task force, and more than 100 publications are there to his credit. Welcome, Dr. Pankaj Bharadwaj, to this webinar. And our next speaker is Advocate Saroja Sundaram, who is the Executive Director at the Citizen, Consumer and Civic Action Group. She leads CAG's work related to consumer protection, where she leads a research project on various consumer issues. And she's also part of the stakeholder process on FoPL facilitated by FSSCI. And she's also a member of the Bureau of Indian Standards, TRI, various policymaking bodies. In addition to that, she is representing India and South Asia in the Council of the Consumers International, which is headquartered in London, which is the global voice of consumers representing in the UN bodies and all since 2019. And we have Mr. Amit Khurana. He is the director of the Food Safety and Toxins Program at the Center for Science and Environment, where he works on food-related issues that are linked with public health and environment. These include antibiotic use in food animal production systems and AMR, pesticide use in agriculture and organic farming, and junk foods and non-communicable disease. Amit is also part of the stakeholder group on a FoPL facilitated by FSSCI. I welcome Amit Khurana also to this webinar. Being introduced the speakers, now I invite Dr. Alexandra Johns for her presentation on what India can learn from 5 years of voluntary health star ratings in Australia. Over to you, Dr. Alexandra.
Thank you. Thanks for the invitation. Can you see my screen with the slides?
Yes.
Yes. Okay, great. As introduced, I'm a researcher and also a lawyer, and I did my PhD on Australia's front of pack label because it had just been implemented when I started. And I also looked at sort of the good features of other front of pack labels worldwide. So today I want to present a summary of all the evidence. And I know that George referred to a couple of papers, but there's been a lot of papers, and then really share some of the things that I think India could do better based on what we've learned here. I should say that I'm on a government committee where I represent public health and consumer groups on health star rating governance, and we try and hold the industry to account. But everything I say today is my own opinion based on my research, and I'm not representing the voice of that group. So I will talk a bit about labeling and what we can learn from the first 5 years of health stars in Australia, but I really want to focus and give you some points to consider about what I think India should learn from us. The first thing I want to say is that food labeling is a good policy, but it's really important to remember that food labeling is only one of the policies we need to improve diets. So whenever we're thinking about front of pack labeling and what it can do, it's important to remember that we want evidence that it's working, but we wouldn't expect it to be doing everything. It can't fix everything. This is a map of front of pack labels worldwide that I've borrowed from a group in North America who made this nice graphic. And so you can see here that there's over 32 countries that have some kind of government endorsed FoPL. And there isn't a consistent one that everyone is using. As you can see here in the Americas, in South America specifically, we have a lot of the warning type of labels that were mentioned in the introduction. And they're mandatory, which is the red. But we also have in Europe, especially a lot of this Nutri-Score now. This is another type of summary score that's in 7 countries in Europe. And down in Australia, we have this Health Star rating, which is also a summary score. So there isn't a global consensus, and this is why it's tricky for India now. There isn't a global consensus in the evidence that one label is good for all countries, or perhaps also that one label is the best at achieving one goal. Different countries might have different goals that they want to achieve with their front of pack label. I also want you to keep in mind that labeling sort of works in 2 ways. And when we think about the evidence of if it's working, we want to look at both. So at the top, we have the way that it works on consumers. So as was introduced, we wanted to make the label easier for consumers to understand nutrition information. Can somebody mute, please? And yeah, so we wanted to make the label easier for consumers to understand and use. And then ideally, we want to shift their purchasing. But this kind of evidence is harder to show. And we also wanted to have a positive impact on manufacturers so that they ideally will start making healthy foods or stop making the least healthy foods. So 5 years on in Australia, what can I tell you about the Health Star rating? This is some government pictures that accompany the Health Star rating, so promotional materials. This is how they want you to think about using it, which is, you can see it there, the blue stars on the pack. There's no, in the Australian law, in the Australian rules, you can display the Health Star in any color, but you mostly see it in blue and black. And you have it here on products, and you also have it surrounded by a lot of fresh food. So the message the government wants you to take is that you should eat a diet with a lot of unpackaged foods. And then when you're eating packaged foods, you should use the Health Star to help you make a healthier choice. It's a government-led system, but it was developed in collaboration with industry, public health, and consumer groups. So that quote from the person in New Zealand that I've not heard of before, he was saying that it was brought by industry. This is not true, as we have at least in the recorded evidence, that there were committees that were deciding what to have. And actually, a lot of public health groups in Australia, we wanted traffic lights, because at that point, the UK had traffic lights, and traffic lights looked like they were the best. There was no country with warning labels at that point. And health groups wanted traffic lights in Australia. And it's true, industry said they did not want traffic lights. And then we had these committees where we had all groups sitting at the table to come up with a new rating system. But that system was developed by all these groups together. So it rates foods from 0.5 to 5 stars, as was said in the introduction, and it has been voluntarily implemented for the past 5 years. And that's something I'd really like to focus on today, and this point about mandatory labeling. The aim of Health Stars, and this is also where it may be different in India, is to guide consumers towards healthier choices. So it's to help them identify and compare products that are part of a healthy diet and not part of a healthy diet. That may be different from the aim in India, and that's something I'm not sure of, so I need you guys to film. And from the very beginning, there was always going to be a 5-year review to see how the system was performing. Because there's a lot of focus on how the system scores foods, I'll just reiterate. So it has what we call a nutrient profiling system, or a scoring system, that takes into account 7 factors. You basically lose points for your energy, your salt, sugar, and your fat. But some foods can score points back for fiber and protein and vegetable content. Not all foods can score those positive points. You have to pass a threshold of healthiness. So it's not true that all foods can game the system. Also, it doesn't take into account vitamins, as was mentioned in the introduction. They're not factored in. There's a lot of things you just can't factor in. So we haven't factored in processing at the moment. We haven't factored in vitamins. These debates about what are the right things to factor in scoring systems are still going on globally. But we get an overall score from 0.5 to 5 in Australia. And it depends on what category you're in. as to how you fall out. So a 5-star dairy product is not the same as a 5-star non-dairy product, for example. But the message is that when you're picking between similar items on the shelf, so between 2 yogurts or between 2 breakfast cereals, the one with the highest star should be a healthier choice. This is just a visual. So if you had 3 breakfast cereals, you can see the range of scores amongst them, and the one with the more sugar obviously gets a lower score. We have now a lot of papers about how Health Stars is performing. So during my PhD, I did an evidence review paper, and that had the findings from 33 different papers in it and 21 different government reports. And altogether, what that evidence suggests is that the awareness of Health Stars is increasing, and slowly also consumer trust is increasing, but it still could be higher. Consumer trust is still a problem in Australia. There's low exposure to the education campaign. So we had very poor education campaigns on Health Stars in Australia, and many people just didn't know how to use the system. But we still know that even without the campaign, if you ask most people, they can understand it and they can use it to make a healthier choice. People also say that they like Health Stars better than the nutrient declaration on the back of pack. So those numbers that most people we know they don't use. So Health Stars is better than that. It also performed better than the traffic light label in many experiments, and definitely better than the industry preferred label, which I'll show on the next slide. But that's another big lesson, is that it's definitely an improvement from what industry wanted in Australia. People say they're using the Health Star when they're shopping. So they report that they use it to make a healthier choice when government does the big surveys, but we don't yet have any evidence of shifts in purchasing. And I think that's not really surprising, because it's voluntary, it's not on that many products. So it'd be hard to show how much it's changing purchasing. This was the old industry preferred label in Australia. So you may recognize something similar, seen it on some products in India. These are the ones that are what we call non-interpretive. And we know that they definitely do not work, and they can be really confusing and sometimes worse than nothing, I think. So this is what we had on many foods, and this is what we have now with Health Star. And this is definitely performing better. In terms of the scoring system, a lot of the focus has been on whether Health Stars scores products right. And you've given some examples. There's been a lot of focus in the media on products that seem unhealthy and seem to be scoring too high. So a lot of focus of the 5-year review was on improving the scoring system. One thing to bear in mind is that the scoring system in Australia actually comes from something we already have in law for making health and nutrient claims in Australia. So it was already there, and we adapted it for Health Stars. You will have a different starting point in India, I suspect. The other problem with the scoring system in Australia is that industry was on the committee that adapted the scoring system, and this caused a lot of mistrust from consumers. So it's another lesson in how you involve industry. In my PhD, I did this study where I looked at what every food in the food supply would score if they had a Health Star on them. So not only the products that were showing the star on the pack in the supermarket, but all products. And the blue products in this slide are what the Australian Dietary Guidelines would call healthy. And you can see that most of them score on the lower area, which is a higher Health Star. So you see that most of the healthy products score a high Health Star. The red products are the unhealthy products in Australia, the discretionary ones. And you can see that also most of them score a low Health Star. But there are these products that seem unhealthy but score a higher Health Star. And this has been the real focus of the review on how we fix these outliers or anomalies. So it's been taken very seriously in Australia, and I think the review has made some improvements, but health groups would definitely like some of these foods to still score lower stars. The main problem for me with Health Stars in Australia, the main problem for me is that they're voluntary. And we've done now a lot of research to show that we have a voluntary system. Unsurprisingly, companies use the system where they score well, and they don't put stars on the pack if they get a low score. So in this figure, you can see that 42% of products after 4 years, so still less than half of all products after 4 years, had put health stars on, and 3/4 of all the products that had stars got 3 or above. So if they get a good score, they're putting it on. And if only 14% of products that get 1 star are showing it on pack. I should say that the companies who put stars on, regardless of what they score, that is the supermarket chains. They make a lot of the private label products. I'm not sure how it is in India, but here we have a lot of those supermarkets making their own products, and they will put stars on, which is a good thing for consumers. Just as an example, here's some products made by companies using the ratings. So on the left, you have this cereal made by Sanitarium, and they get 5 for their Weet-Bix, but they have not put stars on their Marmite, which would only get 1.5. And here you have Kellogg's, they put their stars on their breakfast cereals, where they generally get a high score. And they have not put stars on these children's cereal bars that they sell, and they would score 0.5 star. So this is a kind of selective use that you will see if you get a voluntary system. So as I said, there've been a 5-year formal review. The purpose of the review was to test whether Health Stars was achieving its objectives and to look at options for improving it. That review looked at the scoring system as well as the campaign and how we're governing Health Stars. And there was a lot of public consultation during that review as well. We had an independent reviewer, so the government appointed an independent consulting group to do the review to try and keep it independent of everyone else. What that reviewer found overall, and I say this is overall, is that the Health Star was actually doing what it said it was going to do, but at the same time, there were areas we needed to improve it. So when they say overall, what they're saying is that Australian consumers can understand and use it, and they say they like it. They say they want it on more products, but right now it's still only on some products, and we need to improve the scoring system. So that's what the focus of the review was really on. We still have support from both the big political parties in Australia to continue to fund the system. So it's now entering its second phase. Unfortunately, it remains voluntary. We narrowly missed the vote to make it mandatory. And that to me is the main disappointment coming out of the review. I should say for political context in Australia, it appears unlikely that we're going to get any other front of pack label. So I know that the authors who published the paper that you spoke about at the beginning, they want warnings. And some people want warnings, but we don't think that our current government will support warnings. So most of the public health groups in Australia are focused on improving what we have. But this is a different situation from where you're at right now. So finally, just thinking about India. From my research on Health Stars, but also my research on the other systems worldwide, I think you need to, there are a few rules in making sure you get a good front of pack label, whichever one you pick. The first is that you need an interpretive label. So not the one with all the numbers in it that I showed that industry often likes. We know consumers can't use them. You need one that uses symbols and colors or a mix of these things to really signal healthiness. So both a health star and a warning meets this criteria of being interpretive, but the industry preferred sort of daily guides do not. You need a format that signals product unhealthiness. And we know that from the European research now, as well as the results from the warnings and health stars. Both health stars and warnings can show unhealthiness, but what we've seen from a voluntary health star is that it doesn't really do this. So a warning definitely shows unhealthiness. A health star may show unhealthiness. You really need to have mandatory implementation for consumers to get the full benefit. And I can't say that clearly enough. And I really hope that India has the political will to get a mandatory label. And you really need to make sure you have some rules about where industry is involved. Because when industry is involved, I think the main lesson we've learned in Australia is even if industry don't change the label design that much or change the scoring system that much, it creates distrust amongst consumers. So consumers trust government-led labeling. And one of the best things I think that Chile and some of the other warnings have is that they have a Ministry of Health endorsement on their label. And I would love to see that on a label, and I think it's important for consumers. So I think that's pretty much it for me. My final words for India would be just thinking about what's your aim specifically. Do you want to warn people away from the foods with the high risk nutrients, or do you want to guide them towards healthier choices? This will impact which front of pack you choose. And you need to test what kind of format works well in the Indian population. And I believe that evidence is being generated now, and that may be different to Australia. And you need to make sure that the nutrient profile you pick suits your label. So I think you mentioned earlier, you've already developed the nutrients and the scoring points. So you need to pick a front of pack that works with that. And you need to make sure that you have clear rules for how industry is involved. Thank you.
Thank you, Alexandra, for that wonderful presentation. You have spoken about the importance of FoPL in general, and specifically how does FoPL work in a country like Australia. And also you have focused on the outcome of the government review of 5 years of the HSR process in Australia. And you concluded with some of your suggestions for what type of FoPL work for a country like India. At the same time, you have highlighted some of the concerns. One is consumer trust is still a problem in Australia. And also you have mentioned the industry is in the committee which decided about HSR, which created a mistrust among the consumers. More importantly, as we know, it is voluntarily, FoPL in Australia. So how the companies are playing with this by selective use of star labeling, as you said, the products which get high star, they display the star. At the same time, the products which is, they are sure that will be getting lower stars, they don't display that. This is one of the main problem with the voluntary type of FoPL. That is the reason that we are advocating for a mandatory labeling in India. We will come back to you with questions after all the presentation. Once again, thank you so much. Now I invite Dr. Pankaj Bharadwaj. He will be speaking on need for effective warning labels, its health impacts. Over to you, Dr. Pankaj.
Thank you, Mr. George. And let me share my screen. I think I would be able to do that. So if my screen is visible.
Yes. Yeah.
Thank you so much. So thanks, Mr. George, for giving me this opportunity to speak or discuss my points. It's a different gathering. I should acknowledge this first, and thanks to Alexandra for bringing all these experiences from Australia. To tell you, or before I begin, I represent academia as well as a research organization who's working in public health. But let me take it on board today that when it comes to diet, or when it comes to nutrition or food, it's more about therapeutic diet, where we usually talk about. So it's an area, I think, where the academia and the doctors, they should start working in. And thanks again for this opportunity. So I'll be very brief, as I said, because it's a new area for all doctors to enter into, more from the consumer side or from the civil society organizations who are working for years together. As Mr. George said, it's already an 8 years old battle which they've been engaged in, but it's a new one for us. So the references for my work or slides would be from the work which I could get from different countries, because it's a new area in India also. So for the next 7 or 10 minutes or so, how am I going to start this entire presentation would be to looking at all these important questions which come to my mind when I get engaged in this journey for few 6, 7, 8 months when I get engaged in activities related to FoPL. So these are some of the questions that what I'll be dealing with. That what is the current situation in non-communicable diseases, because that make a kind of a background that why do we need FoPL in a country like ours, where communicable disease is still a problem. We are dealing with COVID-19, or where we have different issues. but I would take you to some of the situations in non-communicable diseases. The questions related to what an unhealthy diet means for us, different FoPLs, though Alexandra has already spoken about that. And do warning labels really worked? As she said, that there is a lot of evidence available now in literature or research. So when it comes to the key facts about NCDs, let me make it a point that World Health Organization is currently working on it, and there is continuous research which is going on, which says that now it is actually an important problem, not in the countries like US or United Kingdom or Australia. Rather, it is more so in low and middle income countries like ours. As you can see that around 71% of all deaths globally are attributed to non-communicable diseases. And when it comes to the premature deaths, 85% of these premature deaths which are occurring due to non-communicable diseases are reported from a country like ours. So if you look at the NCD deaths, you can see that 77% of all deaths are actually reported from our country. So when we look at the kind of reasons or the kind of risk factors which led to these NCDs or non-communicable diseases, then we know that tobacco use, physical inactivity, this harmful use of alcohol, and definitely unhealthy diets add to that. And if you look at the first important factor where the academia, where government, where civil society organizations are working so well, are tobacco use. And I think this is an example from where the concept of FOPL has started generating, that from tobacco to unhealthy diets, which can definitely lead to an improvement in the mortality or morbidity from NCDs. So when it comes to India, again, a few of the points which I would like to mention, and I say that to all my patients also, that it's the time when we should catch our youngers, catch them young. Because in 2017, we find that the data which came that India is going to be the second largest population of 73 million diabetic patients after China. And we know that 2045, it is going to be doubled. And there are data of International Diabetic Foundation, which are actually started calling our country as the diabetic capital in world. So when it comes to unhealthy diets, so what an unhealthy diet actually meant for us, doctors, is that it is the overconsumption of this ultra processed food, sugary drinks, and which is actually increasing the risk of obesity or type 2 diabetes and heart diseases. So as Mr. George has already mentioned, that when it comes to HFSS food items, these are which are high in fat, sugar, and salt, and which contain low amount of proteins, vitamins, and minerals, and all these dietary fibers, which are very important. And they are very important factors which actually protect us from the risk of NCDs. Now, two things which are very important for all of us to understand about HFSS food is that both the frequency as well as the amount, both actually are important when it comes to their important effect on the morbidity or mortality. So Indian Academy of Pediatrics, they've come up with this new mnemonic or abbreviations, and they have started calling it as JUNKS, where they make a kind of whole statement that when it is unhealthy, unhealthy stands for all these food where there is food which is high in fat, in trans fats, sugars, or salt. It is which is ultra processed as per the NOVA classification, or which is N, or which is nutritionally inappropriate food. And very interesting to see when we were going through this deliberation that even a homemade food which is not prepared well, or which is prepared in a recycled oil or contain high amount of sugar or fat or salt, is actually nutritionally inappropriate food, and it's also an unhealthy nutrient. And I think that is one of the questions which I will echo with Alexandra, is that it's not only the FOPL which is the only solution to all the problems, because all these food items which are still nutritionally inappropriate and unhealthy add to the risk of non-communicable disease. C stands for caffeinated, colored, or carbonated beverages, and S, which is a sugar-sweetened beverages. India, as we all know, we are born with a sweet tooth, and it's the only country, I think, or one of those countries where for every reward, there is a chocolate, the chocolate which is being given by grandparents, the chocolate which is given by teachers, colleagues. So sugar consumption, if you look at this, is being increasing in Asia and India. And the annual growth, if you look at the sugar consumption, is at the rate of 4%, which is double the rate of consumption in the rest of the world. You can see the world consumption of sugar 2013-14 data, which shows that India is actually having a greatest contribution of 26. And if you look at the domestic sugar requirement, it is touching a record of 30 million tons by year 2020. And all of us will agree that even during the time of complementary feeding, or we call it as Anprashan, in India, culturally, what we do is that we feed our baby. For the first, food which we give is sugar. So if you look at the sugar scale, I think most of us know it well that all these beverages, they are having a huge amount or a considerable amount of sugar, which is there, and starting from any cola drink or to any beverage which is available. Now, doctors or researchers, they've started calling sugar as a new cigarette. As we all know, that different in vitro studies have shown, and in vivo also shows that 93% of the lab rats, they chose sugar water over cooking. So we can understand the gravity of situation that we need to understand, right from the consumers to public health to civil society organization and doctors, when we know the level of addiction which the sugar is adding. So this is again one chart, one graph, which I would like to share with you. Countries like Sri Lanka, which is very well known for having a very strong public health system, have started giving these kind of labels where they are actually putting these labels on the sugar packet that it is addictive and cause diabetes as a case of warning labels which they are using. So you can see the kind of association or a correlation of US sugar intake versus obesity prevalence, as being mentioned by my earlier expert, that there are very many studies which are going on currently. So when it comes to processed and ultra processed food, we all know that Nova classified in three groups, and these processed and ultra processed food consumption is increasing with leaps and bounds. And if you look at the consumption, it's increasing from 2 kg into not 5 to around 6 kg in 2019, and it's expected to have an increase up to 8 kg per capita sales by 2024. The ultra processed beverages, they are also having the same projections, and it's been projected to reach up to 10 liters in 2024. Now, when we come to the health impact, as I represent academia and medical school, so health impacts, there are very many studies which are going on currently, and WHO is also a part of that, which says that if you look at the processed food, the danger starts from the cardiovascular risk to hypertension, to diabetes, and reach to a level of cancer causing. So if you look at the processed meat, where they say that it's just being processed because it needs to be kept to increase the shelf life or for preservation purpose. But the statement says that there are not many studies, and there is no dearth of studies for that, which says that there is a strongest evidence now that by eating processed food, there are high risk of getting colorectal cancer followed by stomach cancer. As we were discussing that in a country like ours, where we have different socioeconomic backgrounds and also the level of education, I was just trying to get few studies from health sector, because when it comes to health sectors, we are the first one to know the risk. But the studies show that even in nurses and health professionals, follow-up studies, they show that there is a higher intake of ultra-processed foods and meats, these potato chips, which actually resulting in weight gains and much more risk of getting the higher mortality or morbidity in different years. A very interesting study I found, as I was saying, because we are working on the WHO Health Promoting School Initiative, that we have seen that in few of the universities of Navarra, the Spanish university, it was found that the higher consumption, which is around 4 servings per day of this ultra-processed food, was seen to be associated with 62% increased risk of death, as compared to those who are having around 2 servings per day. So these studies very clearly showed that additional daily servings of these kind of food, it adds to an increased risk, which is of the level of 18% increased risk of death. We also did few studies 11 years back when we did this kind of study in a part in Lucknow in North India. We found that the most important factor which comes out to be for the reasons or the risk factors for having obesity was consumption of fast food, which was of the order of 19% in the overweight or obese children. There are different studies, and as our earlier speaker Alexandra was speaking, that there were no dearth of studies, the randomized control trials, observational studies, appetite surveys. They found that these participants, they ate 500 calories more on these ultra processed food and gained weight 2 pounds with this consumption. So I think this was a compendium of studies. I was going through the literature that the Food and Agricultural Organization have released. There are around 6 peer-reviewed articles which showed that there is a huge correlation which they could find out with the NCD outcomes ranging from obesity to cardiovascular health, cancers, and also adding to mental health like depression, asthma, gastrointestinal diseases, frailty, and it's very clearly mentioned that there is an all-cause cardiovascular and cancer mortality with these. Now there comes now the role of FoPL. So that was a background which I thought that is an important from our side, from being the medical side, that there is always a need to have now critical nutrients of public health concerns to make that level or that upper limit intake. So for those who are already working, it's not a new thing, but for those who are new, we know that these critical nutrients are when we say that these 10% from free sugars or 10% from saturated fats or 30% from total fats or 1% from trans fat. So for example, for sodium, we were going through different back of package labeling where we find that the most important thing which is missing in these pack is actually sodium or salt content. And the recommendation has an absolute and a relative upper limit, which is actually not mentioned in most of these packets. For adults, we say that if it is an average 2000 kilocalorie, the sodium intake should be lower than 2000 milligram of one. For children, it should definitely be less than that. So as we all know that this whole responsibility or this kind of conduct lies on Codex Alimentaricus Commission, which is jointly releasing its document with the WHO and FAO. And apart from these 2 declarations, which are the Nutrient Declaration and Nutrition and Health Claims, there is a supplementary nutritional information need, which they suggest, as Alexandra has very rightly mentioned, that in most of the countries, it's not mandatory, rather voluntarily, that there is a guideline to have or a suggestion to have FoPL in these packets. So we all know, and I'll not go in details of what FoPL is all about. It is on a principal field of vision on the front of package, as Mr. George has already mentioned, in a language which a country like ours, people of different socioeconomic background, of their academic background can understand, and that understanding is to increase the overall insight on the nutritional value of food. But now the title or the topic where which I'm going to deliberate for the next 2 or 3 minutes would be that these warnings. So what these warnings
Excuse me, doctor. Yeah. Sorry to interrupt. If you can just conclude in 2 minutes.
Yes, sir.
Yeah.
Yeah. So I'll go directly to the kind of warning label studies, which I think was an important part for explaining. And I've borrowed this slide from the media report from one of our speaker himself in the Center for Science and Environmental Studies, which they say that these are already there. These are simple and effective measures which are being utilized in this. But in India, it's a new thing, as already mentioned by my earlier speaker. And it's the drafting guideline, which says about this system of draft FSS. And I think a lot of deliberation from the consumer side and civil society organizations which are working on this CSE. So what are the evidences which are there, which shows that the use of these kind of warning labels have actually working well? The studies in Chile, as it is very well said by my earlier speaker also, that the studies in India are very less. They have shown that these kind of warning labels have actually decreased the purchases from a considerable value. So it's around 24% reduction relative to expected purchases. There is also that the kind of calorie intake in the kind of sugary drinks also been reduced from 30 calories per day to kind of 30, which is 3.5% reduction in the level. So again, all analysis which have so far been done in different countries have shown a considerable value in actually getting a high value when it comes to the consumption and the morbidity differences. So I'll sum up my slide as been mentioned earlier, that these effective warning labels are definitely having good evidences, and they are informing and empowering consumers for these healthy choices. And this is also giving, because these warning labels, as mentioned earlier also, are easily understandable, and so they are actually potentially improving health quality and benefit public health at large. Thank you so much for a patient listening. Thank you so much.
Thanks, Dr. Pankaj, for that very informative presentation. You started with the current situation of NCDs both globally and in India, and he spoke in detail about the food with unhealthy nutrients, the junks, and also the problems with the processed and the ultra processed food, and mainly concentrated on the health impacts, and concluded by saying, talking about the FoPL and the effectiveness of this warning label. We will come back with the questions later. Now I move on to the next speaker and invite Advocate Saroja Sundaram, mainly to speak from a consumer perspective. Over to you, Saroja.
Yeah. Thank you, George. Thank you for inviting me to this very important webinar. I think most of the speakers have, like the previous speakers have already mentioned, almost covered all the points, and I think whatever I'm going to say now, like I'm going to reiterate whatever has been said earlier. So from a consumer point of view, like what are the concerns before me as a consumer? So one, as mentioned by the previous speakers, like, so the longitudinal aging study of India 2021 report undertaken by the Ministry of Health and Family Welfare through the International Institute of Population Sciences reveals that 45% of grown-up Indians above the age of 45 are suffering from hypertension, and another 40% with pre-hypertension. So undetected, untreated, and undertreated hypertension has been ranked as the highest risk factor for heart disease and related deaths. On the other problem is about diabetes in India, which the previous speaker, Dr. Bharadwaj, had highlighted about. The studies reveal that around 77 million people are diabetic in India, and we are the second most affected in the world. So again, we know what are the problems associated with diabetes, the complications associated with diabetes. So these are the two major concerns that, so we have an impending crisis on our hand, I should say. So there is an urgent need to address this. On the other hand, we have moved towards increasingly moved towards consumption of processed food. This culture has grown over the last few decades. If we look back a few decades earlier, actually, mostly we used to consume either cooked or raw food, and but over the years, with the markets open, like we have lots of varieties of processed food available and drinks available today, and we have actually gotten used to that culture. So what does this mean? Like, we don't know actually the ingredients or the nutritional information. Of course, the regulator has recognized this, and they have come out with regulations mandating the need for detailed nutritional information to be available on the labels, and nutritional information is provided. So what are the challenges with that actually? So nutritional information is available. So as George had mentioned earlier, consumers take only few seconds to actually look at a label. So they don't, normally they don't look at the nutritional information provided on the label. Even if they read, many people don't understand what it means, what it actually means is another issue. The other is about the language. The language could be a barrier for many, because mostly it is only in English, and so people may not understand the language. There are several who don't understand. So this again is another concern. So these are the issues with the present system. So it doesn't seem to actually serve the purpose, this detailed nutritional information that is available on labels. So what is it that we want as consumers? So with this increase, so when I go to a doctor, I go to a doctor, I'm diagnosed as being hypertensive. So what the doctor advises me, he asks me to take food with reduce intake of salt. This is the advice given by the doctor. So if I am a diabetic, the doctor advises me to actually cut down on sugar intake. So this is the advice from my doctor. So now I go to a shop, to a store to buy processed food, a packaged food. So what is the information that I need? I need the package to tell me that I should have food that doesn't have sugar in it, or it has reduced salt in it. So this, or if the product is actually high on sugar and salt, that warning is given to me so that I make an informed choice. I decide, okay, let me not buy this for now. So this information is what we are looking for on the front of pack label as far as India goes. So this information is very, very critical, because we don't know if, so does it mean that this only will change the entire scenario? No, not at all. There are several other steps that need to be taken to actually educate consumers on like what they should be doing, create awareness, and several other things should happen simultaneously at the same time. This is one important medium through which we inform consumers that this particular food is high on sugar or salt, so that they are able to actually decide on whether, depending on their health, they are able to make an informed decision on what they need to buy. Similarly, when we talk about FoPL, the other important component is the science-based parameters that has to be decided on what are the levels of sugar, salt, and fat that should be present in processed food, the very, very, very varied food products actually. So that needs to be determined. It should be science-based, and the design of the label. So the label should, I would actually, what comes to my mind immediately is the vegetarian and the non-vegetarian logos that are present. Consumers are able to easily identify. If it is green, then it's vegetarian. If it is red, then it is non-vegetarian. So they are able to easily identify. So something like that, which is actually like, as soon as I see a label, I should know that it is high on salt, it is high on sugar, so that I will be able to actually quickly decide on whether I need to buy the product or not. So that is how the designing of the label is very important. So when we talk about this, since we are the discussion is about health star rating, whether we should go for that or not, I would like to compare it with, George briefly touched upon it, I would like to compare it with the energy efficient star rating that is given for energy efficient products. Same star rating is given for energy efficient products. And I must tell you that rarely do consumers actually look for it when they buy electrical products. So this has been the experience, and we have actually done some study on that to see that consumers very rarely look for that information when they buy products, electrical products. So the same would apply here in my understanding actually. So that is one major concern. The other is actually the health star rating will not achieve the purpose, because it's not going to actually specifically mention increase in sugar and salt content in the product. So it probably evaluates the overall goodness and badness of the food, but then it doesn't exactly mention the level of risk nutrients present, the salt or sugar in it. And so high-risk consumers who will be very careful in choosing the products should know about the presence of the nutrients of concern and their amounts in a straightforward way. So the HSR, I don't think will address it in a direct manner, actually. And with diverse social groups, as I mentioned earlier, star rating can cause confusion. So, and actually, considering the way how things are here, there like its truthfulness will also become a point of concern at point in time. That may be a question of manipulation and reliability. All these may come into play. And another thing I think we need to think about is the local and small scale manufacturing units. They will find it very difficult to actually do the calculations, and actually with the health star rating, they may mislead consumers with the wrong information because they may not understand the calculations behind it. So I think these are the concerns as far as the health star rating goes. And for Indian consumer, what is most needed is a proper, very clearly identifiable a label, which warning label, which will help the Indian consumer to make informed choices. I think, yeah. So with this, I would like to conclude. Thank you very much, George, for this opportunity. Thank you.
Thank you, Saroja. From a consumer perspective, you have well shared your thought. You started with how India is on a high risk in terms of hypertension and diabetes. And you have focused more on what consumer want. Several things you have shared, and also you have mentioned when the thresholds are decided, it has to be based on science-based threshold. And what is required for India is a simple labeling which the consumer at the grassroots can understand. And you also had mentioned HSR will mislead the consumers in the country. We will come back with the questions later. Once again, thanks. Now I invite Mr. Amit Khurana. He will be speaking on lessons learned from other countries and how India can move forward based on this experience. Now I invite Amit. Over to you, Amit.
Thank you very much, George. Hello, everyone. I can just say that it was, every time I come to a discussion like this, there's a lot of memories that come to my mind. It's been actually quite a while. We did our first study in 2012 on junk foods, and that time the labels did not really say much, not even the back of the pack label. So you actually had to test how much of salt or sugar or fat is there. And from there on, we were part of the first committee, FSSAI-led committee in 2013. And I can still remember the images of those discussions with the industry folks is still in my mind. What kind of arguments that used to come to our, those were kind of used to delay, digress, or dilute the entire issue. But nevertheless, it's quite encouraging to see that that we are discussing it at a public platform today. Most encouraging is the fact that we have doctors with us today. That was not the case 10 years ago, Dr. Pankaj, I can tell you. We really struggled to have doctors on board who would come forward and publicly talk about this issue. So that's very encouraging. But at the same time, it's also disheartening. It has taken like 8 years now, ever since we were part of this committee, which recommended FOP label, and clearly there have been two drafts by the regulator. Several committees, if I'm not wrong, 4 committees, and now we have one more, right? So we have several committees, 2 drafts, and we still do not know where we are heading. So that's and we do not know when it will happen or whether it will happen or not. So that's the other part of the story. But nevertheless, let me try and see what I can kind of contribute to this discussion based on my experience. A lot of that has been said already. So very much agreed with Alexandra when she says that we need a lot more. It is not only about FOPL. Yes, Very much true, Alexandra. And that was what the first committee was actually talking about. The first committee in 2013 said, it was actually said to regulate the school, junk foods in schools. And at that time, we said that would not be enough. We also need labeling. We also need to regulate the advertisement. We also need to do something on the celebrity endorsement. We also need to do on the nutrition literacy, the understanding on the balanced diet, so on and so forth. So I mean, that said, why we need FOP today? Why we need? I mean, apart from the fact that the NCD burden is increasing, the economic burden of the NCD burden is increasing, and the fact that diets are transitioning. All of us know our children are eating much more junk foods than ever before. Even adults are eating much more. We are constantly bombarded with the advertisements from all corners. I mean, all kinds of media, be it print, be it electronic, be it social media, it's all over. And on top of that, we do not know what to do with it. I mean, the regulator so far has not really been so strong as it would have been. It should have been. So somewhere consumers are, the Indian citizens are left to manage themselves, figure out what they want to do with this, and that is where the problem is. Apart from that, why do we need this? We know the current set of labeling, which is nutrition fact labeling. We have spent like several years to actually introduce just sodium into the nutrition fact label. I mean, a country where hypertension is becoming a household phenomenon, we just managed to have salt as part of a mandatory declaration. And in that case, not only salt, it actually is sodium. I mean, just a riddle for all of you. I mean, how many of us can really figure out how much salt we are consuming if we are essentially consuming a product which says 1070 milligram of sodium in 100 grams? Can any of us quickly figure that out? And that's not possible. Even those which are scientifically inclined will struggle. How many of us would really be able to figure out how much of sugar our children have consumed from a chocolate which says an unrealistic serving size of 10 or 12 grams, but the child has already eaten 3/4 of the chocolate? So where are we heading, and how the nutrition fact labeling is actually helping us? So the answer is, it is not helping us. It is only confusing us. What it is helping only the industry, because industry so far has managed to spend so much time on the nutrition fact labeling and create a position that, yes, we are working on it. Yes, there's some improvement. We are disclosing what you want to know. The fact is, they don't want to let us know how much their food is bad. And that's where the problem lies in. And that's where the focus on FOP label comes into picture. The another important part here is, so what is the use of nutrition fact labeling? So in my view, it is only for scientific compliance and enforcement. And at best, it can help if it is complemented with the FOP label. In isolation, it will not help the consumer. We have seen that happening in our country. Ours is not a country which has a very high literacy rate. All that is in English, all that is very technical. We know the language changes every 100 kilometers down the line. I mean, then you need a magnifying glass to read what is there on the nutrition fact labeling. And then you also need to know what is an RDA, how much sugar one needs to actually consume in a day, if at all one needs to consume sugar. So it is really, really not helping us. It is helping the industry. Please keep that in mind. What can possibly help the consumer is FOPL label. So there I'm trying to emphasize the need for FOP labeling is very, very high. So, but then I also want to tell you, what are we talking about here? We are basically saying junk foods, ultra-processed foods, and are they really foods? We know that the experts have been talking for the last many years that these are actually not real foods. These are factory-made products. And this distinction has to be very clear in my mind. They're high in bad nutrients. We all know salt, sugar, fat. They do not have fiber. They do not have other good part of the nutrient, which is micronutrients. And then of course they have chemicals. They have chemicals which otherwise we do not use in our kitchens. And the industry has been successful so far in basically changing the narrative of junk foods to HFSS foods, because that only tells you one part of the story, that does not tells you completely the other part of the story, which is about ultra processed nature of that, lack of fiber, so on and so forth. So here we are at a loss again. And there are many other words: energy dense foods, foods of minimal nutrition value. All these are words which are used interchangeably. And of course, the famous argument that HFSS means that the traditional Indian snacks are also junk foods. But one has to keep in mind, they may have high salt, sugar, and fat, but they can be controlled. We can educate people to reduce the salt, sugar, and fat in the foods that they cook at their homes or in the canteens. They are not sold, they are not aggressively bombarded at us. They are not advertised. That's why there's a difference between when we say HFSS and junk food, and we have to be mindful of that the packaged ultra processed food is the real junk food, which is actually not food. And it's not me who is saying that. We all know that. I mean, somebody talked about Carlos Pontiero. I mean, somebody represented the NOVA classification. I mean, he himself, I know one of his works, he very clearly said, which says that they are formulation of low-cost industrial ingredients. Such foods result from the fractionation of whole foods into components and then recombination of these components, such as protein isolates, starch, sugar, oils. Thus, such foods do not preserve the food matrix, and therefore they should not be actually called as foods. They're not real foods. Please understand that. In fact, the way these are marketed, and also because of the addictive nature of the food, somebody also mentioned about the addictive nature of foods. It is very clear now that junk foods, because of the ingredients it has, it is addictive. They are now compared with the tobacco, and therefore they need to be labeled like a tobacco. People need to be warned like that. It is no longer about, at least in the Indian context, it is no longer about just telling people this is the way it is. We need to warn people. That's the responsibility that the government has to now play. Now, how the world is addressing FOP labeling. I mean, clearly, governments who are serious about managing NCDs, FOPL is a part of their strategy. Several countries we know, and these are not only European countries, these are countries in Latin America. There are some developing countries also. These are countries in Asia who have adopted or either led the FOPL system. Several models, we all know: traffic light, reference intake, GDA, summary indicators, warning labels. We all know that. By now, this discussion should be over in that context. But I'll still very briefly say the GDA, for example, or the reference intake is largely an industry, is the most industry favored model. They have been doing that in many countries. Essentially, it confuses people. It does not tell people what they want to do. It's a duplication of the back of the pack labeling thing. You really don't need that many numbers. Traffic light, the problem is mixed messaging. You can have red and green. So that's a fundamental problem there. It also has a lot of numbers. Summary indicators, clearly they are more of a claim as far as we understand in India. They take away the focus from the negative nutrients, and they cannot help anyone know which nutrient is high. In my view, they are ideal setting, they are ideal recipe to mislead the consumer, the naive consumer in India, if I may say so. So now imagine health, the word health, and the word stars on a label of the most unhealthy foods in the world. Health and stars. That is the kind of strategy these are adopted. So I'm sorry, Alexandra, that's what I see this in India. I see this as a very strong industry tactic. And the central message that I get from your presentation is that if you were there, if Australia was to decide today, perhaps they would not have chosen the warning labels, because at that time it was not warning labels. And therefore it's important for us to now leapfrog. We need to learn from the mistakes of the other countries and adopt the best practices of the world today. Today we have warning labels. There's no point even thinking about anything other than warning labels. And if we do that, that would be a regressive approach. If we do that, that would be something, it's like we know what is best, but we still don't want to adopt what is best. So that's how it would be, I would see it. So we have to be very careful on that part. So what should we do in India? Very clearly, we should adopt warning labels, simple, effective, but a lot of talk is going on Chilean model, Colombian model, Peru model by the Peru, Mexico, so on and so forth. But my feeling is it's the model that has symbols will work in India. It will transcend the barriers of illiteracy, and the barriers of multiple languages. We really need to look at the Israeli label. That is something that will help. A spoon for a sugar, or let's say butter, or knife for a fat is something that is something that we should look for. Anything other than that, in my view, would suit the industry and not the consumer. Now, what kind of nutrients we should talk about? Clearly, Salt should be on the FOP label and not the sodium. Sodium can be there at the back of the pack label and both will complement. The decision in most countries where they have sodium is essentially based on their knowledge of the salt or sodium. We know that the Indian community has been talking about salt. Our campaigns of the public of the FSSAI, for example, talk about aaj se thoda kam namak. They don't say aaj se thoda kam sodium. So we have to be very careful what we say. And therefore, salt is very important. We need to also have total sugar and not added sugar. I know a decision has been taken, but we do not know what happens. I mean, these decisions were taken in 2018 also. So we have to still re-emphasize the point that yes, it's about total sugar and not added sugar. Added sugar can't be analytically measured. We'll have to rely on the industry declaration. Certainly not a way to go. So total sugar is something that needs to be taken into account. But the RDA of 50 grams, which was used for added sugar, cannot be which was used for total sugar in 2018 draft, cannot be the same for the total sugar. Total sugar RDA cannot be more than 50 grams. We know that the industry is pushing for much higher relaxed limits for RDA of total sugar, because we are now switching from added sugar to total sugar, and that's not a way to go. The experts all over the world, the experts in India also have said that not more than 25 grams for added sugar. In fact, I would argue no one needs sugar. Sugar is not needed. There are studies which say you don't need this synthetic sugar. It's largely addictive, and what the body needs already gets it from the complex carbohydrates, from the real foods which I'm talking about. So any amount of, and that's where we have to cap the RD. Also, the important part, we are focusing on saturated fats. I don't think that's a good idea. We should talk about total fat on the FOP label, if not instead of saturated fat, but also in addition to. And that's essentially because saturated fat is only about cardiovascular health in adults, but total fat is about obesity and metabolic syndrome, and that is increasing in children also. So it would address the health needs of a larger set of population. And selective picking of one will not help. The industry can still have a very high total fat if they can manage a saturated fat. That would not be a good idea. And then, of course, the no amount of good fat, let's say, can make this bad food into a good food. That also has to be taken into consideration. We know that we also know that the Indian recommendations have been on managing the mix of the oils. It's not really about capping one or the other in that sense. I mean, we also know that saturated fat is bad or unsaturated fat is good. Both of these statements may not be completely true. So the real public health message on the fat has always been mix the oils, manage the omega-3 and omega-9 ratios. And therefore, it's important we do not demonize the saturated fats, so that the dairy industry in India, for example, or the foods where the Indian nutrition is very much dependent upon, gets unnecessarily disadvantaged. So that's where we are on the nutrients. On thresholds, I just want to say, we had a very good set of thresholds in the 2018 draft, which were put up by FSSAI. Those were based on the WHO CRO limits. If the FSSAI is keen to talk about to take into different direction, for example, 2 categories threshold, then of course those should be based on the global best practices. Something like a threshold for a summary indicator, which are calculated at the back end and have much higher limits, would not go. I just want to lastly say, industry will keep on pushing for weak and regressive regulations. They will keep on diluting and delaying, but it's the responsibility of the regulator to take a strong action. In the interest of consumer and public health, we now know that what is working and what is not working in other parts of the world. We need to be progressive, keep consumer at the core. The interest of the industry cannot supersede the interest of the consumer. And I just want to say that FSSAI knows this. They have the success of veg, non-veg label, fortification label, the success of label for organic, the Javik logo. They know how the front of pack labeling works. And the most recently, we now see vegan for the labels for the vegan. So FSSAI knows this. So therefore, India must learn from mistakes of other countries and actually adopt the best practices which are there today. 8 years before, it was the traffic light labeling when we suggested traffic light labeling, but today it is very clear it's warning label. So that's what is should be the case. With that, I rest my intervention. I'm so sorry if I'm over time. So thank you very much.
Thanks, Amit. Sharing your thoughts. You started with sharing your 8 years of experience in the FoPL process. And also you have mentioned how the nutrition back of the pack nutrition label is not working in a country like India. And you strongly advocated for a FoPL, especially a simple and interpretive warning label, which overcome the barriers of language and the literacy. And you concluded by saying the role of the regulator, how they should overcome the industry tactics and, in the consumer interest to act. We will come back with the questions. Now, almost the time is over, but we will take a few more minutes. I have received a number of questions to Alexandra. So the first question is, what are the challenges consumers are facing in interpreting the Australian HSR labels? The other one is, do you think if a country adopts the HSR label, then it is the responsibility of the government to educate consumers not just about the label, but also about how to use this label as an effective tool? So I think these two questions are there. And also if you want to respond to the comments by any other speakers, very, very briefly. Over to you, Alexandra. Yeah.
Sure, I'll try and be brief. So I think the main challenge facing consumers is that health stars aren't on everything. And so you can't really use this as a tool to make a better choice if it's only on every second food or every third food you look at. So that's definitely what I see as the main shortcoming for it. And the second one, I forget what you asked, sorry. But I think picking up off one of the things that Amit said that I think is true is that we started, we adopted this in 2014, but we started negotiations years before that. And the context was different then. And I think it's important that India does learn. I mean, I don't necessarily agree. I think based on all the evidence, as I said, that there isn't global consensus at Codex or any of these places that one is best for all countries. But if India has the will to go for warnings and you think it achieves your aim, there's plenty of evidence to support warnings. So I think, Europe is pursuing Nutri-Score. They're going a different direction. But if you want to argue that warnings are the best for India, I think there's plentiful evidence for you to draw upon.
Yeah, thanks, Alexandra. If time permit, we can come back. Or do you want me to repeat the other question? The role of the government. Yeah.
Oh, the role of the government. I think that ideally, if you have a label that's easy to understand and it's on all the products it should be on, you shouldn't need to have a huge campaign for it because it should be obvious. You're seeing it every day. I mean, the countries like Chile and some of the others that have done the best with this, it's because the label isn't just on pack, but it's linked to their school food program. It's linked to their marketing restrictions. So kids know if they see a food with a label, it means that's a bad food. It can't be sold at school. It can't be advertised. So you get this messaging, consistent messaging everywhere. And I think that's the most effective. It's not necessarily funding a big campaign that goes forever to tell you how to use it. You should know how to use it as soon as you see it.
Yeah, maybe the Indian context is different. Like, we need to have a massive awareness campaign in educating the people, how you can use it as an effective tool, the FoPL. May not necessary that it is the Australian context. Other question is, what is the FoPL format or the model suitable for India? I think Amit had already made it clear. We should go for a warning label. Saroja, you want to have any final comments?
Sorry, yeah. So actually, from a consumer point of view, I reiterate the point that I had mentioned earlier. I think the design of the label should be very simple and straightforward for a common person to understand. So it's very important that it is designed in such a manner so that consumer, as soon as he checks the label, as I had mentioned earlier, I gave the example of the vegetarian and the non-vegetarian logos, and so something like that, which will actually help consumer make an informed choice as soon as he looks at the label. I think it's very important that we actually come up with that, because ultimately it's health. It's something associated with the health of consumers. Therefore, I think that should be the priority of the government, of the regulator, when they come up with the design. Yeah, with this I would like to conclude. Thank you.
Yeah. Thanks, Saroja. Any final response from Amit? 30 seconds.
No, I've said what I wanted to. Thank you.
Yeah. Thanks, Amit. Then I think there are a lot more questions, but due to the time constraint, we will conclude here. Dr. Pankaj had left. Actually, he need to attend another meeting. Now I invite my colleague, Simi TV, to sum up and to propose the vote of thanks. Over to you, Simi.
Thank you, George. That was one interesting deliberation, and I'm sure we were able to successfully convey a message together in one voice. So before winding up for the day, I would like to briefly reiterate whatever was said and discussed. George opened the webinar by providing an overview of what an FoPL is, where India stands with respect to regulation related to FoPL, the progress about FSSAI consultations, and why health and advocacy experts in India are strongly pitching in for a simple but effective warning label. Then Dr. Jones presented the Australian experience with regard to voluntary health star labeling and showed what India can learn from it. She underlined that given that there is no global consensus on a particular type of FoPL, every country has to choose the label based on their country needs and situation. Next, Dr. Pankaj cautioned us about the health crisis due to consumption of unhealthy food products and why the country urgently needs an effective warning label. Our good friend Saroja spoke about the whole issue from a consumer perspective and expressed concern regarding the growing health crisis and urgent need to address it. She also reminded how the existing detailed nutritional summary provided in the back of product never served the purpose due to language barrier and consumer ignorance about its purpose. So FoPL should always be simple, easy, interpretable by a consumer, which would help him to identify unhealthy products. Then Amit gave a larger overview of FoPL and broadly spoke about why India desperately needs a FoPL. One of the interesting observations which he made, and which I am sure we all would agree, is all that is in English and all that are technical are often ignored by consumers in India, where every 100-kilometer distance, the local language changes. This effectively sums up why a country like India needs a simple, effective, and easy to understanding warning label, which would address the language barrier. Then I am sure that the questions raised by the participants to the panelists were well addressed. And that's it. That was a great. Thank you, everyone. We appreciate you all being here. We promise we'll take this forward till the last mile is achieved. Special thanks to Dr. Alexandra Jones for sharing her country experience and helping us to move forward in the right direction. Also, heartfelt thanks to Dr. Pankaj, Saroja, and Amit for readily accepting our invitation and sharing their thoughts on this topic. Your support means a lot to us. We also extend a sincere thanks to all participants, especially to the representative of various state food safety commissionerates across the country, the health experts, and many others. We would, in the coming days, share the proceedings of this webinar with you all, and the same would be uploaded in our website. Last but not the least, I would also personally thank my wonderful team members here at CUTS, without whose support this timely event wouldn't have been materialized. Thank you all. And with that, I think we can bring down the curtains to today's webinar.
Yeah.
Hope to see you all again soon.